What if I told you that right now, millions of people over 60 are walking around with a damaged liver, and they have absolutely no idea, no pain, no symptoms, nothing, until one day their doctor runs a routine blood test and says those four words nobody wants to hear. You have a fatty liver. Here's what makes this so serious. Your liver does over 500 jobs in your body every single day. It filters your blood, balances your blood sugar, processes every medication you take, and burns your body fat. When it gets clogged up with fat, every single one of those jobs suffers. But here's the good news, and this is why I made this video today. Fatty liver is one of the very few conditions that is almost completely reversible, and it can happen faster than most people think, naturally, without surgery, without expensive treatments. Stay with me, because by the end of this video, you're going to know exactly what to eat, what to stop doing, and what lifestyle steps research confirms can begin reversing fatty liver in as little as 48 weeks. Let's start with the basics. Fatty liver. Doctors call it non-alcoholic fatty liver disease, or NAFLD. Simply means that too much fat has built up inside your liver cells. A healthy liver has a small amount of fat. That's normal. But when fat makes up more than 5% of the liver's weight, it starts interfering with how the liver functions. And the numbers are alarming. Research published in the Journal of Hepatology found that fatty liver affects roughly 40% of adults over the age of 60 in the United States. That's nearly 1 in 2 seniors. Why are older adults so vulnerable? 3 main reasons. First, metabolism slows significantly with age, making it easier for fat to accumulate in the liver. Second, insulin resistance, where the body struggles to process sugar properly, becomes more common after 60, and excess sugar gets converted directly into liver fat. Third, reduced physical activity means less fat is being burned off. The dangerous part? Most people feel nothing. Fatty liver is almost completely silent in its early stages. By the time symptoms like fatigue, mild discomfort on the right side of the abdomen, or brain fog appear, the condition has often been developing for years. Left untreated, fatty liver can progress to liver inflammation, then scarring, called cirrhosis, and eventually liver failure. That's the worst-case scenario. But we're not going there, because you now know, and knowledge is where reversal begins. Quick question for you. Have you been told by your doctor that you have fatty liver, or that your liver enzymes are elevated? Drop a yes or no in the comments right now. You'd be surprised how many people watching this are in the exact same situation. And your comment helps me understand what topics to cover next. Before we talk about reversing fatty liver, we need to talk about what's causing it, because if you don't remove the cause, nothing else will work long-term. And the number one cause that affects seniors specifically is something almost everyone consumes daily: refined sugar and refined carbohydrates. Not fat, not even alcohol in most cases. Sugar. Here's why. When you eat refined carbohydrates, white bread, white rice, pasta, sugary drinks, packaged snacks, breakfast cereals, your body breaks them down rapidly into glucose. Your blood sugar spikes. Your pancreas releases insulin to manage it. But when this happens repeatedly over years, your liver starts converting that excess sugar directly into fat and storing it inside itself. A process called lipogenesis. Research published in the Journal of Clinical Investigation confirmed that fructose and refined carbohydrates are the primary dietary drivers of fatty liver disease in adults who don't drink alcohol. The single fastest dietary change you can make? Eliminate or dramatically reduce sugar and white refined carbohydrates. No sugary drinks. No white bread. No packaged snacks. No fruit juices. Yes, even orange juice, because the fructose without fiber hits your liver hard. This one change alone, consistently applied, has been shown in clinical studies to begin reducing liver fat within 2 to 4 weeks. Now let's get into the full reversal plan. These are not guesses. Every single strategy here is backed by published clinical research. Step 1. Eat these liver-healing foods every day. Green Circle coffee. Yes, really. This surprises most people. Multiple large studies, including a major review in the Journal of Hepatology, found that regular coffee consumption, 2 to 3 cups per day, is associated with significantly lower liver fat, lower liver enzyme levels, and reduced risk of liver fibrosis. Researchers believe antioxidants called polyphenol in coffee protect liver cells. Black coffee or with a small amount of milk. not loaded with sugar or syrup. Green Circle Extra Virgin Olive Oil. A study published in Nutrition and Metabolism found that replacing refined cooking oils with extra virgin olive oil significantly reduced liver fat and improved liver enzyme levels in adults with fatty liver. Use it as your primary cooking oil and for salad dressings. 2 tablespoons a day is the research-supported amount. Green Circle Leafy Green Vegetables. Spinach, kale, arugula, and broccoli contain nitrates and antioxidants that have been specifically shown to reduce fat accumulation in liver cells. A Swedish study found that eating leafy greens daily meaningfully reduced liver fat, even without other dietary changes. Green Circle Walnuts. Rich in omega-3 fatty acids and antioxidants. A clinical study in the Journal of the American College of Nutrition found that regular walnut consumption improved liver function tests and reduced liver fat in patients with fatty liver disease. A small handful, about 7 to 8 walnuts, per day is sufficient. Green Circle Fatty Fish, salmon, mackerel, sardines. Omega-3 fatty acids from fish directly reduce liver fat and inflammation. Research published in World Journal of Gastroenterology found that omega-3 supplementation reduced liver fat by up to 30% in fatty liver patients. Aim for 2 to 3 servings of fatty fish per week. Green Circle Green Tea. A study in the International Journal of Molecular Sciences found that the antioxidants in green tea, called catechins, reduce liver fat accumulation and improve liver enzyme levels. 2 to 3 cups per day showed measurable benefit within 12 weeks. Step 2. The 30-minute daily walk that changes everything. Exercise is arguably the single most powerful intervention for fatty liver, independent of weight loss. A landmark study in hepatology found that 150 minutes of moderate aerobic exercise per week, that's just 30 minutes a day, 5 days a week, reduced liver fat by an average of 30 to 40% over 8 weeks. Even in participants who didn't lose a single pound on the scale. Why does movement matter so much for the liver specifically? Because exercise activates an enzyme called AMPK that directly tells the liver to start burning stored fat rather than accumulating more. Walking is enough. You don't need a gym. You don't need to run. 30 minutes of brisk walking per day is one of the most effective liver treatments in existence. If walking is difficult due to joint problems or mobility, swimming or chair-based aerobic exercises provide similar metabolic benefits. Step 3. Cut these 3 things completely. Crossmark sugary drinks, sodas, fruit juices, energy drinks, sweet tea. These are liquid fructose delivered directly to your liver. Crossmark alcohol. Even moderate amounts significantly worsen liver fat and inflammation. If you have fatty liver, the research is clear. Any alcohol slows or reverses your progress. Crossmark ultra-processed foods, packaged snacks, fast food, frozen meals high in refined oils and corn syrup. These combine sugar, bad fats, and chemical additives that together create a toxic load on your liver. Step 4. Consider these 2 supplements. With doctor approval. Vitamin E. A major clinical trial called the Pivens trial, published in the New England Journal of Medicine, found that vitamin E at 800 IU per day significantly reduced liver inflammation and improved liver cell health in non-diabetic adults with fatty liver. This is one of the few supplements with strong trial-level evidence for fatty liver. Always discuss with your doctor before starting, especially if you are on blood thinners. Milk thistle, silymarin, used for liver support for centuries and now backed by modern research. A review in the journal Phytotherapy Research found that silymarin reduced liver enzymes and showed anti-inflammatory properties in fatty liver patients. 140 milligrams 2 to 3 times daily is the commonly studied dose. I want to ask you something important right here. Which of these steps do you think will be hardest for you to stick to? Cutting the sugar? Starting to walk daily? Giving up fruit juice? Be honest in the comments. Because knowing your specific obstacle is the first step to overcoming it, and your answer might help someone else watching this right now. This is the question everyone wants answered. How long does it actually take? Here's what the research shows in real timelines: 2 to 4 weeks. After cutting refined sugar and increasing vegetables and healthy fats, liver enzyme levels and blood tests typically begin improving. You may also notice less bloating and more energy. 4 to 8 weeks. With consistent diet changes and daily walking, Imaging studies have shown measurable reductions in liver fat content at the 4 to 8 week mark. 3 to 6 months. Sustained lifestyle changes can reduce liver fat to near normal levels in many patients with early-stage fatty liver. Some studies have shown complete reversal within 6 months. The key word in all of this is consistent. Your liver didn't accumulate fat overnight, and it won't release it overnight. But unlike most chronic conditions, fatty liver responds quickly and dramatically to the right lifestyle changes. The liver is one of the most regenerative organs in the human body. Give it what it needs, and it will heal. Here is your complete action plan starting today. White heavy checkmark: eliminate refined sugar, white carbohydrates, and sugary drinks. White heavy checkmark: add coffee, olive oil, leafy greens, walnuts, fatty fish, and green tea to your daily diet. White heavy checkmark: walk 30 minutes every day. No excuses. No gym required. White heavy checkmark: cut alcohol completely while your liver heals. White heavy checkmark: talk to your doctor about vitamin E and milk thistle. White heavy checkmark: get your liver enzyme levels tested every 8 to 12 weeks to track your progress. Your liver is waiting to heal. It is designed to heal. And now you have the roadmap. If this video helped you today, please hit the thumbs up. It takes 1 second, and it helps us reach another senior who needs this information right now. Subscribe to this channel if you haven't already, because every week we're covering the real health topics that matter most after 60. And leave a comment below. Tell me which step you're starting with today. I read every single one. Your liver has been working for you every day of your life. Now it's time to work for it. I'll see you in the next video. Take good care.